So advocacy, what is it? It strengthens the health care and health research processes. That is, it provides unique benefit to patients and survivors. It changes the way that doctors and researchers and others in the healthcare system see patients and consider their needs. It adds a level of urgency to what they're doing. And it keeps patients at the very center of all healthcare efforts, their thinking, and the conduct, and that is essential. It is, from my way of thinking, a field of healthcare itself. And it's a field that places, again, and keeps patients at the center of all that goes on. It gives voice to all patients, survivors, caregivers, and communities. The benefit that you receive from patient advocacy goes far beyond the individual advocates. And I think that's a very important piece of what patient advocacy is. It is not so much about the individual, although it serves the individual. It serves and informs patient communities. It serves whole communities in the entire system. So it's not just about a small segment of the community. The patient advocacy that might go on here in Washington, D.C., where I live, might also affect patient advocacy in Nairobi, in Kenya, because we all are a collective body that work together for the best service to patients and best benefit and outcomes for patients wherever they live. It educates patients, the public, and the healthcare professionals. And this is bi-directional education. So it's not just that one of us is getting education and the other is receiving it. It's very mutual. We patients educate the healthcare system itself, and all the practitioners, and they in turn educate us, and we all have an obligation to educate, I believe, the public. So at its core, I see patient advocacy as a high-touch communal activity, or enterprise that's centered on communicating and sharing. Central to being an advocate is the ability to communicate the things that you learn, you find, you experience, and to share those broadly. If you receive information or you have certain kinds of experiences that are important to the whole, if you don't share them, in fact, that's sort of your self-advocacy perhaps, but it is not broader advocacy, community advocacy. And one of the other things that it's centered on is sort of the acknowledgement and the appreciation of the unique perspectives that patients and the patient communities bring to the conversation. This acknowledgement is a must. We have to understand and value what's added by patient voices. These are unique voices. This is unique information. This is unique involvement that we have no other way of really knowing the extent of. It comes with positive interaction and sort of visible results. And it sometimes, takes time to gain that sort of respect and so on. So I'm going to mention what it is, what patient advocacy is, what it isn't, and what I think it requires. Okay, I think it's sort of a good faith commitment, a partnership between patients and others in the healthcare system. So we've all decided we're going to partner in this thing. It's necessary if we want patient-centered, patient-accessible healthcare system. If we don't have patients involved and the community involved at a certain level, we're not going to have a system that really is centered on patients and that makes patient access easy and doable. So it also is patient-focused, of course, and patient-responsive. So a system of advocacy responds to the patient's needs, and it responds to the healthcare needs as well. It isn't easy. It really isn't for the faint of heart. It's not for people who are easily discouraged. It takes time. It's not self-centered. That is, it is not centered on the self. It's not centered on me. As an advocate, what I do is about the collective. I may share my own personal experiences occasionally, but I'm trying to speak more for the collective, for a larger body than myself. And it's not a short-term project. It is really a long-term commitment when you get into advocacy. So it requires dedicated advocates, and it requires a volunteer, what we like to talk about as a volunteer workforce. And you find ways to compensate, but I think you do have to find ways to compensate individuals and communities. We talk about it being a volunteer workforce, but in fact, you need to make sure that people can afford, and I mean afford both in terms of their time, their energy, the economics of it, to be advocates and to do this thing well. So, you know, what is left in the wake of your interaction in the community? You know, what is it that you leave with the community? What does the community receive? Is there any necessary infrastructure that's there? Are there ongoing programs and things? So we need to think about all of these things when we interact in the community as advocates. It requires a supportive, respectful healthcare system. And it means we all respect each other. That no matter what our cultural divides might be in terms of how we interact, patient to doctor and so on, we have to have a respectful, supportive system. It requires ongoing training. Again, I've been an advocate now for 24 years or more, and I'm always learning things. I think you have to be open to learning. You don't have to be a medical specialist. You don't have to have any training in biology. You don't have to have that kind of a specialty, but you have to be open and willing to learn. And you have to be able to clearly message things, to share that information that you've learned. It requires a commitment, and the commitment as an individual, public commitment, time, financial and logistical. And again, there is a financial component to advocacy. So don't think that it's free, that you just sort of go out and find, you know, a certain number of people who have been patients or who have been caregivers or who are just caring community members who care about the health of their community. There's a financial cost to this. So when you're getting funding for other programming, you need to make sure that you include that as a component of funding. And of course, it requires a supportive network. And it's all of this thing about the strength of the collective. There are individual advocates, but advocacy is not a standalone, self-centered activity. So that's important to sort of say.